Visit the virtual tour of the oncology department in the Gaspe Hospital. This video will show you the first day of your treatments and how they will unfold. Imagine you have just discovered that you have a diagnosis of cancer. The unknown is a stress alone, so the oncology department of Gaspe Hospital have prepared a short guided tour of your first day of receiving chemotherapy treatments. This will help to minimize some of your stress and the fear of the unknown. You will meet the team and be made aware of the services available. Do not forget that you have us to help you fight the disease. You are not alone. Have a good visit. Before beginning your treatments, you will be contacted by the infirmière pivot, or the navigator nurse. She will make sure that your questions are answered and will review treatments, how they will proceed, and introduce you to the team. The nurse in the chemotherapy treatment area will inform you of side effects, prevention, and how to better take care of yourself during this stressful time. The team includes doctors, pharmacists, and nurses who will meet you and implicate you in the process of your treatment. You will have better control of how to prevent and manage any side effects. For more information, check out the website cancergaspez.ca. These video clips may help you better understand any side effects, symptoms, and give you many solutions. At your leisure, you and your family can view them at any time. The Department of Oncology is located on the 4th floor of the hospital. They suggest that you are accompanied by someone for the first treatment, as this may decrease your stress, as you will be given a lot of information. Also, depending on the treatment protocol, a medication may be administered to you that may cause drowsiness, therefore you may not be able to drive. Upon arrival at the oncology department, let your nurse know that you will be in the waiting room. When she is available, she will come and get you to begin your treatment. There is a resource of information pamphlets in the waiting room regarding prevention, detection, and self-care. Feel free to take them at any time. Before starting your treatments, you are encountered by a doctor who will review your treatments and expectations at every visit. A family member or friend may be present if you wish, as there is a lot of information to be given. A good idea may be to write any questions down before you go in to see the doctor and even take notes during your visit. Next, your nurse will weigh you at every visit, as the dose of chemotherapy is calculated by the height and weight. The pharmacy and their team will then prepare the treatment in a sterile area specially made for chemotherapy. Your nurse will then put a catheter in your arm to begin treatment with a saline solution. If your vein access is difficult, or depending on protocol of the treatment, it may be necessary for a larger venous access, like a porter cath, to be installed. This may minimize a lot of problems. During your treatment, a pharmacist will meet you to review your medications, any potential side effects that there may be. They also want to make you aware that they work in collaboration with the pharmacies in the community. Your treatment may be anywhere from 2 hours to 6 hours, so it is very important not to book anything else on that day. You may bring your computer, your tablet, books during your treatment. You will also be offered a meal, and as well there is massage therapy available. This is sponsored by the Canadian Cancer Association East of Quebec, ASAC, and has been made available for patients during the treatment, even up to 3 hours per week. They are trained professionals in oncology, and this really helps to reduce the stress during your stay with us. We call it the chemotherapy spa. Enjoy. After the first treatment, the nurses will make a follow-up phone call to reassure you and to answer any questions that you may have.
Good afternoon. My name is Lynette McGregor. I'm a pharmacist here at the Gaspe Hospital. in oncology. When you come into the department here, you will meet a lot of healthcare professionals. I'm the pharmacist here, one of the pharmacists. You'll meet the physician, as well, probably the nutritionist, and the nurses as well on the floor. We prepare, actually, when it comes to the medication part of it, we prepare your medication in a separate part. It's not done on the oncology department. It's done downstairs in the pharmacy. There's a sterile hood. So the preparations are very strict because we also have to protect the people preparing it so that they're not exposed to the drug. And as well for your safety as well too, to make sure that it's sterile and there's no bacteria in it that could put you at risk. And then once those are being prepared by a technician, once they're prepared, I'm able to see on my computer screen here on the left, I'm able to visualize the exact drug to make sure it's in the right dose, the right patient. So I also have a label here as well too, and to make sure that the quantities are exact that have been prescribed for you. So once the prescription has been given to me, I will calculate it, or my colleague will calculate it, and then I upload it onto the computer, and then once it's filled, then it gets delivered to the floor and then off to the chemo department, where then once you will receive it by the nurse. We as pharmacists then sit down with you at every treatment, and we will discuss and we'll go over side effects and any of your concerns. And then following that, when you go home with your family members may assist in the process as well too, because we do know that the patients don't absorb all the information that is given in that day, and we don't expect you to. But our information is on there and our telephone number, and you can feel free to contact us anytime during your treatment in the event that there's a question that's raised, or you're not understanding something, or you're not sure on how to take your medications. Please feel comfortable to do so. We're here from Monday to Friday from 8 to 4. However, we do work in close conjunction with your community pharmacist. So your community pharmacist is aware of your treatment. We fax them at the beginning of all of this process, and so they're aware of what protocol you're on. So don't hesitate to contact them either, because if we're not available, they may be able to answer your question that you have at hand. Like I said again, if there's any questions, don't hesitate to call.
We hope that this video reassures you and gives you some insight into our oncology family and your journey with us.